And we're live.
Okay.
Well,
I don't know whether I'm doing a good afternoon to everyone who is listening. This is a meeting of the Health Policy Commission Administration and Finance Committee, where we go in deep depth into the budgetary aspects of the commission and related to what was agreed to by the governor and the legislature. And we're going to get a report from both our executive director, David Self, and his deputy, Colleen Ostermeyer. So I will turn the meeting over to David.
Great. Thank you, Mr. Chairman, and thank you, commissioners, for joining us on this meeting today. First, just want to take a moment to introduce the other HPC staff who are on the call. I think all familiar to all of you. We have Lois Johnson, our general counsel, John Proctor, our chief financial advisor, Susan Flanagan Cahill, our deputy general counsel, as well as, of course, our deputy executive director, Colleen Ostermeyer. So for today's meeting of the Administration and Finance Committee, we wanted to take this opportunity to brief commissioners on our spending performance over the last fiscal year, and begin to have a conversation about the spending plan for next fiscal year. As many of you know, I'm sure, the state fiscal year ends on June 30th every year. And the HPC's budget is something that the board is asked to vote to approve on every year. We have kind of an interesting process for doing that, as you might imagine, because our line item, which contains our appropriation for the fiscal year, is set every year as part of the state budget. And this is a process where the House and the Senate and ultimately the governor agree on this state annual budget, which includes an appropriation to the HPC. That process is almost complete. Just last Friday, the House and Senate came to an agreement on what their spending plan for the new fiscal year would be. And right now, that spending plan and proposal, commonly referred to as the conference committee report, is under review by the executive branch and administration and finance. And ultimately, the governor will make final decisions about whether to approve the proposal, reject certain elements of the proposal, or amend the proposal with his own ideas. And so the process is not quite finished. And so what we're going to be teeing up today and tomorrow is a continuing resolution for the HPC. And this will just authorize us to continue our operations until such time as we're able to meet again, which will likely be in September, with full knowledge of what the final state budget will be. And at that point, I would present kind of the full 2022 spending plan for board approval. So this committee is not voting today. We are planning to vote for tomorrow. As I said, that is this continuing resolution that will allow us to keep going until September, at which point then we would have the full budget. So nonetheless, wanted to take this opportunity to review with you last year's operating budget, what we know so far about what the final budget may include, and some general updates on HPC operations and responsibilities as we start to plan for the next fiscal year. So with that, I'm going to start with the fiscal 2021 year, which ended, as I said, on June 30th. And so the next slide summarizes the three sources of funding that were available to the HPC to expend in fiscal year 21. So the first is our main line item appropriation, which was funded at, as you can see, $10 million. We are projecting final spending of close to $9 million, and I'll speak a little bit more about this. This main line item is funded through an annual assessment on our hospitals, health plans, and ambulatory surgery centers, and is not is basically holds the state budget harmless as we collect the revenue that then offsets this appropriation. Secondly, from time to time, the legislature does provide us additional funding for targeted programs or initiatives. And so they did do this a while back and had appropriated $800,000 for 2 new investment programs for the HPC to administer. We spent most of this past fiscal year working to design these investment programs. And as you might imagine, the impact of COVID-19 and the pandemic made it very difficult for us to think about launching a new investment program when all of our provider organizations were rightly focused on addressing the pandemic. And so these are 2 programs. One is C4SEN, which is targeting substance-exposed newborns, and the BESIDE program, which is around maternal health. Both of these now, C4SEN, we are contracted with providers. You have approved the awards. We have contracted with providers. And for the BESIDE program, we have released an RFP and are collecting applications. But the upshot here is that due to the pandemic and due to the development of these programs, while we did have $800,000 available to us in this last fiscal year, we did not end up spending that. And we're requesting through the legislature and the administration that that money is moved forward into the next fiscal year so that we'll have the opportunity to spend down on that appropriation once these programs are live. And then finally, in that same similar vein, we had received kind of a push forward of $20,000 from the previous year for one of these, again, legislatively mandated initiatives around academic detailing. We did close that program and did expend that full amount in fiscal 21. So across these 3 budget sources, as you can see, we did spend down on some, others were delayed. And if you move to the next slide, just to specifically talk about our budget, our kind of main line item, as you can see, we had just a little over $10 million available to us and are projecting final spend of around 8.76 million. This can change a little bit. We're still in a period where we can pay bills from the previous fiscal year, so that number may change slightly. But nonetheless, as you can see, we did have a surplus in the fiscal year. And really, I think the primary driver of why we came in under budget was the pandemic and its impact on delaying a number of the responsibilities that are core to the HPC's mission, including the timing of market expansions, many of which were delayed until after the pandemic, the timing for our performance and review plan process, the timing for our cost trends report, and the ongoing development of our pharmaceutical drug review process were all impacted by the COVID-19 pandemic. So while we do project a surplus in this year, we are not projecting that surplus will necessarily translate into future years, as this was really a unique year in so many ways. And in many cases, our needs are probably even greater in the next fiscal year, as you'll see, as many of these activities resume even perhaps more robustly than before. So I'll pause here just to, I can walk through the next slide really quickly. So the one thing I mentioned is that this is an assessed appropriation. And so that assessment is paid for by health plans, hospitals, and ambulatory surgery centers. And they are assessed both the line item amount that is included in the budget, the HPC operating budget, but also certain fringe benefits as assessed by the comptroller. So those are the first 2 lines that you see here. And that $12 million reflects the total both operating budget and fringe benefits for the HPC. What we do every year, though, is we credit our assessees any surpluses or reversions. And so you can see here a minus $1.2 million. That was our surplus from the year before, some technical adjustments. And so the total amount actually assessed to these entities was somewhat lower than the full 12. And that is likely will happen again. As I just mentioned, we had a surplus in fiscal 21 that is credited to the assessors. So when we run a surplus, it's not necessarily the Commonwealth that benefits in the case of the general fund, but it is a credit back to the assessors so that they are made whole if there is a surplus in any given year. So that was a really broad overview of the process and just our experience in the last fiscal year. I have some more information about FTEs and employment, but I'm just going to pause here to see if there are questions about the process or about our experience in fiscal 21.
Any questions from our commissioners? Again, you're going to go into more detail about the allocation of the budget this time or next time, David?
I'm going to keep it at a somewhat high level right now since the state budget isn't finalized, but we'll be able to share a little bit more here.
Okay, well, yeah, because I wasn't sure. I thought you were going to hold off until September.
So yeah, I really have just some more high level
All right.
information to share. So the next slide is just a reflection of our FTE count, which we show at every one of these meetings on an annual basis. And I think the big takeaway here is that we have been, as you can see, really stable at around 60 employees for pretty much, the last 5 years of the HPC. We have a very small but mighty staff. There are a tremendous amount of work that we can do and a tremendous opportunity to grow our workforce. But I think Colleen and I are both proud of the fact that we have been very thoughtful in our hiring and thoughtful in our workforce development, such that we, I think, run a very efficient state government agency for the amount of work and the quality of the work that we produce. I'll just note at the final kind of orange bar you see on the far right-hand side, we did have a few people who, great people who have decided to move on in their careers here at the end of the, when the COVID restrictions were lifted. So right now we're in a little bit of a backfill position and hope to modestly grow in a couple of targeted areas, but very, very small growth here by FTEs. On the next slide now, so that was all reflective of kind of the past fiscal year. I'll just give a quick update on next fiscal year, but as Stuart said, more to come in September. So where are we in this process? As I mentioned, it has gone through many different stages of the budget review process. The state budget is currently at the conference committee under review by the administration, and included in the conference committee report was a budget line item of $10,513,097. We do not yet know what the final budget will be, but we expect to know soon. So just a brief couple notes on that particular number, the 10.5 on the next slide. This was our request to the legislature for our maintenance budget, which is a budgeting term that really just means what will it take to continue to do your core operations and mandated responsibilities in the next fiscal year. And so that was the number we requested. The legislature did include that full funding. I would note that we generally consider this budget request to be conservative, as it was really developed prior to the COVID-19 pandemic and did not reflect perhaps additional funding needs and work stream needs related to the COVID-19 response effort, and where we have provided in-kind support to the command center and will continue to the Department of Public Health for quite some time. So while this is an increase over last year, I think we feel that this is a very, will be a tight budget, one that we can manage, but certainly is not an expansion budget. And then on the next slide, you can just see here what we are going to be presenting as a motion for tomorrow's meeting. So tomorrow we'll ask the board to authorize a continuing budget resolution. That will get us to September. And then we'll have the final budget in hand, and we'll have a final vote on the fiscal year 22 budget at that board meeting. But this will be, we're not voting on this now, but this will be the motion that we'll present tomorrow. So,
yeah. So David, in anticipation of what we might discuss in September, the one thing I asked you last year, and I'm just going to put it on the record again, is that given that we're going to have a discussion tomorrow about some of the pressures on our whole healthcare system in terms of potential increased spending, and for us to understand more, if not do more, to slow the growth. The question is whether you have the flexibility within the staffing you're talking about to reallocate people should they need to be doing different things that they were doing in the past.
that's a wonderful point, Stuart, and certainly can speak about that at more depth in September. I think the short answer to you is that we do feel that the budget number included in the conference report will provide us that level of resources necessary to do our work. And also, as you said, one of, I think, the absolute hallmarks of the HPC and the people that work at the HPC is their willingness to be flexible and to take on different work, to take on new challenges, and to be really adaptive to what will most drive our mission. And so we have adapted many times over the last 8 years and adapted quite significantly during the pandemic. But we'll be happy to give more details on kind of the 10.5 million, how that will break down in terms of staff, contracted supports, and other expenses when presenting the spending plan.
Great. Marty or Ron, do you have any questions?
Yeah, I was following your question, Stuart. Do we have enough in there to bring in contractual help in terms of cost analysis if we need it, given some of the scope of some of the projects that are before us?
I feel confident that we have the resources, and if the budget as proposed is signed to adapt and flex and meet both the kind of novel questions that the commission has raised, as well as some of these market changes, which of course are unpredictable in their timing. And sometimes, we can get a couple all at once and still be able to work with our contractors, work with our consultants, work with, other experts to meet these needs. So I do feel that we will have sufficient resources. As always, it will be, will be tight, but again, can always have flexibility to react to the market dynamics on the ground and the priorities of commissioners.
David, approximately what percentage of the budget is in salaries, and are we allowed to have a discretionary budget as well, or is that not part of how it's structured?
So I don't know if I'll look to John to maybe ballpark out how much the salaries are of the overall, let's just call it $10 million. Yeah. John, I don't know if you can.
About 3.5 to 4 million is what we would expect.
And then we have always set aside every year, and we'll around $2 million that is set aside for professional contracted services. So these are when we work with our economists, when we work with actuaries, when we work with experts on research projects. And so that $2 million is quite flexible, Ron, in terms of, where we want to allocate those. Salary is less flexible. At a certain point,
Right.
we, kind of reach how many people we can hire and staff in a given year. But the professional services has always been a kind of a flexible part of our budget, and allows us to react, kind of in real time. And where this year, where we had a surplus, a lot of that was in that professional services category because we were not conducting the same types of reviews that we would be otherwise have done during the pandemic. The last thing I would note, which is not something that we're proposing or really have proposed in the past, but the HPC is a steward of a trust fund that does still have some remaining funding available to it. And if the need arose, we do have the ability to tap that as well, and that goes beyond our annual appropriation. But that is not something that we have typically done as we've been really trying to work within our annual state budget appropriation.
Hey, are you allowed to cut back on contractors, for example, and utilize it to hire more personnel, or is that, I assume that's allowed if that's the decision?
It is with some guardrails, for sure, but we have the ability to work with to move money around in the categories as needs may change during the year, and that's a great flexibility to have as well.
I would just add, Ron, we've gone back and forth over the past 9.5 years on the build versus buy. With staff, do we have them on staff with 40% fringe benefits associated with them, or do we hire contractors? And we go back and forth even on work streams that have been ongoing for 9.5 years. And then
I do that every day.
Yeah, I know you do. And then the only thing I would add is that David will present in the fall all the trust fund balances and where they stand, so you can see exactly how much we have left in both of our trust funds.
Thank you.
So there's this motion that ultimately the full commission will have to approve, but we have to, as the committee, approve it, right?
We're not asking for a vote of the committee. I think we would ask for your endorsement tomorrow at the full board meeting to let the board know that this committee met, that you received this updated information and support the motion for this continuing resolution until September.
If it helps, we can approve it here, and isn't it right?
Well,
it is something that needs the full board approval. So but thank you.
Well, I think you have our approval, and we look forward to a more in-depth discussion in September.
That's great. The one last thing I just wanted to share with you, I like to use these meetings as an opportunity as well, just to give you some insights on HPC operations and all of the great work that Colleen does running this agency. And I think we are so proud of our staff and their ability to pivot during this last 1.5 years to work remotely. And to just produce incredible work during this time period. But if you skip ahead 2 slides, one more slide, we are planning to return to the office. And so Colleen wants to give a quick update on that for you as well.
I've gotten a lot of questions from board members, so just wanted to give the ANF committee a quick update. Timeline for our office reopening. Won't review the history here of this timeline because it happened to all of you as well. But suffice it to say, we closed the office in March 2020, and we are working on reopening this fall. And in more concrete terms, we'll be fully reopened next year. So Our office is open now, and you're welcome to visit it, in the sense that many of us have gone back on a limited basis since last fall. David is there as we speak. And we're still firming up the fine print of our office return plans, but the future of work is clear, and it is hybrid. And this is as true for state government as it is across all industries. So at the HPC, as David said, we have been so hugely successful this past year, and our staff really have made it clear to us that they appreciate the benefits and flexibility of being able to work from home. So plan to move to a hybrid, two-phase hybrid work model beginning in September, right after Labor Day. Folks can come back a couple of days a week, and then more concrete plans in 2020, but continuing with the hybrid workplace model and planning to employ all the lessons learned in the fall, all the lessons learned over the pandemic, what works for our small agency, what doesn't. And I would just note finally that this time frame is in line with all of our sister agencies. I'm in near constant communication with all the other chiefs of staff, and so everyone is doing the same plan pretty much, even the huge agencies like chia and others. So lots of details to be worked out. Always appreciate your feedback. If you have some, either here or offline, but wanted to just give you a directional sense of how we are handling this. In some ways, it was easier to just make the decision and shut down the office and send everyone home than it is to figure out how to get everyone back to the office. So we're taking it slow, and we're being thoughtful about it. But that's it for me.
Great, thanks, Colleen.
Sure.
So that is our agenda for today, Mr. Chairman. And so thank you for your input and attention. And we look forward to the vote tomorrow, but more importantly, the vote in September to set our budget for the year.
Okay. All right, unless
so much.
there are any final questions,
Yeah,
we'll see you all tomorrow.
Stuart, can I sneak in a question?
Absolutely.
David, was there anything in the conference committee report that you think had will have an impact on our work?
I would say generally no. It was a pretty clean conference report in terms of healthcare policy initiatives. We did not receive any new direct mandates or study proposals. And so I think different than in years past, there wasn't as much of a healthcare policy focus. And I think we understand that the legislature will be working on healthcare legislation on a separate track.
Yeah, thanks.
Yep.
Okay. Anybody else? Ron, you want any final question?
No, thank you.
All right. We are officially